Good evening, and welcome back from our Thanksgiving break. I hope everyone enjoyed their Thanksgiving break. I had a fabulous time myself in the Smoky Mountains. And today is the first day in Module 156, the electronic health record. So, can you all show me the book that we're using for the electronic health record?
I don't know.
Mine's an online book. I don't. It's
So that's telling me that no one read the emails that I've been sending all morning. So guess what? That means you all don't get the 15 bonus points.
mine's an electronic book.
Yes, but it's an electronic book, but you could tell me the name of it and say what it is.
It's
Yeah,
the
but that's what I'm
electronic health record for the physician's office.
okay. So in the email, that's what I say. I mean, so that's fine. That's right, Anthony.
I don't think I get your emails.
Ebony, you're in the roster. I send everything through roster. So then if you're not getting my emails, you are missing a lot of information. I send everything in the roster. And I sent several emails yesterday and today, making sure that everyone, ensuring that you log in to module 156. Today started the new module.
Yeah, I don't think because last when you was telling me you was sending the you send the Zoom or whatever, I don't get them.
But it's in, if you don't get them through the email, it's in your e-learning.
Yeah, I know. I usually watch them through my e-learning, but I don't get emails from you.
Well, I must have the wrong email. So we need to check that, Ebony, to see what's going on, because you're in the portal and it's showing that you're receiving them. Check your spam. Because everything it shows. Would you say, Jerry?
I'm sorry. For my email, it just said, please check your news and announcements for which book. But I didn't go on the news and announcements, so it wasn't in the email. So I just saw this email just now before I logged on for class.
Right, but I sent an email earlier and yesterday stating about we will be in module 156 starting today.
Yeah, I'm logged into 156 or whatever, and I got the PowerPoint pulled up, but I didn't.
Okay.
I didn't check to see which book it was, but I got the PowerPoint and everything pulled up.
Okay. So
yeah, I don't get the. I'm not.
Yeah, so you're gonna have to tell me, because in your in the roster, Ebony. Matter of fact, let me share my screen. And I'm gonna show you your name, and it shows that you received the email, so we can see if it's the right email or if something's going wrong, so we can clarify and get get it corrected. Okay, so in 155.4, you were in 155.16, right? The old one. Let me go to roster. You in 155 or 150, 14 or 16?
Let me see.
The DOTG encourages people to plan. A lot of people use that route to go further south. Some people use it as an alternate route to New Orleans. So I would say absolutely give yourself a little bit more time.
155.
No, 14 or 16. What module?
14.
Okay, so let me go back to 155.14.
Even if they're not there.
Hey, cover your mouth.
And go to the roster. Here you are right here.
Yeah.
So let me click it to see if that's the right email for you.
Australia General is offering free stroke screenings this weekend. The annual event will be held on the second floor there on the screen. Appointments are required.
Ebony, what is it? Pickens, huh?
Uh-huh.
Okay, so right here,
This Saturday from 7:30.
here's your email right here. EP119664@unitechta.edu.
Honestly, I didn't even know I was supposed to log into that email. Where do I log into that at?
That's where you are supposed to have been at through when you got the when you started the class. And they sent you that Microsoft showing you how to log into the system,
Yeah.
the Microsoft 365. So you have to go back, look in your email. It's probably in spam now, but that's where this information, because I don't send stuff to your personal email unless
Oh.
no, that's why I was saying everything goes to your Unitech email. And here it is right here. EP119664@unitechta.edu.
Okay, I'm gonna have to go look for that.
Yeah, check your spam. It was what they sent you that through IT when you started back on October.
I was
3rd.
once logged into it, and then I was once logged into it when they first sent.
Yeah, so that's where you need to go.
Okay.
So let me go back and let you all know. Okay, so in news and announcements, this is the gray section of your e-learning. So let me go to our regular module now. Now we're in module 156. We're in module 156 now. So when you log in into 156, they're going to have this class expectations and tips for success, and it's going to have a picture of your book. It gives you what the name of the book is, what's the module we're in, medical front office skills, learned and applied. Today is November 28th, so this module, it's from 11/28/2023 to January 8th, 2024. And this is the book that we're in, the Electronic Health Record Physician's Office. In your ebooks, I'm gonna see if I can show it looks like this. This is what the book is. So you can always find your book when you go into news and announcements under the welcome. So always make sure that you start out when we get in a new module, making sure that you refresh yourself with the class expectations and tips for success. And then it always tells you when the module starts and when the module ends. Also in your grace section of e-learning, you have your syllabus. This tells you everything that will be covered in this module. Now we're not doing any coding right now because we're doing actual front office. So this would be your hands-on, where you're going to learn how to work with a partner, chart in the medical record, send out correspondence. All of this stuff is going to go on in the electronic health record. You'll see in lesson 1, the introduction to electronic health record. This is what we'll be covering in this chapter. So you'll find all of that in your grade section of e-learning in the syllabus. If you ever need to know, like, what are we covering, your objectives. This is your grade book. So in your grade book, I can show this now because we haven't really even started anything. But in your grade book, it will show you your grade for what your average is thus far when you start submitting your assignments. You press and you click on grade book. Attendance. That takes a while, but your attendance, you'll be able to see if you're absent or present. Right here is your PowerPoint slides. Chapter 1. All of this is in a great section of e-learning, Introduction to the Electronic Health Record, and it goes into what we'll be covering. So what I'm going to do now, I'm going to go back to our book, which is the Electronic Health Record. In your
I don't have it.
So that means you have to go back to your vital source, your ebooks. That's a book that you didn't apply into your cart.
Yeah, the only books that I have is the two coding books, our regular book and our workbook. And then I have three medical assistant books.
Okay, well, no, you uploaded the wrong ones. So you
Okay.
should, yeah, go back, just go back into the Vital Source library
Mm-hmm.
when you log on to get your ebooks, and you're gonna have it and put that in, type that in, and then you can put that into your Vital Source library, put that into your books.
Okay. Oh,
And then you
yeah,
saw what it looked
okay.
like in the news and announcements, right?
Yeah, but you know how you showed your page when your picture is on it and everything like that? It didn't come up on mine like that.
You
When I
see it?
click the overview or any of that kind of stuff,
No,
you know
not
how
overview, the welcome.
I don't even have a welcome on mine.
You don't have the
It
welcome?
just has the MB 156. It has overview, roster, coursework, news and announcements, and all that kind of stuff. Even when you say that you put it in news and announcements, only thing that I have in my news and announcements, it says Zoom class tonight, and they have the link. That's the only thing I have in my news and announcements.
Okay, so in news and announcements, I sent that in an email. In news and announcements, that's what I have in there. Let me go back to it.
Oh, okay.
Yeah, this is what I had in Zoom news and announcements. Zoom class tonight, Tuesday, 6 p.m. That's all I had.
Oh, okay. Well, okay. So I have that. Okay.
Okay. And
In the
then
book,
in the
I have the book.
welcome, right
It's in
here,
my title.
in
Yeah,
the
I don't have a
welcome.
welcome.
Okay, let me see if I open it.
Yeah,
If that'll help.
that I don't see that.
Yeah, I'm about to open it on here for you and see if you see it now.
And then mine is 016. Is that difference? You see how it says MB 156
Yeah, you're in
online
module. Yeah, you're in a different
14?
class. Yeah, I have different classes.
Oh, okay. All right.
That's why when I asked Ebony what class she was in, so you're in 156.16. So I'm gonna go back to that one right now, 156.16, and see if that one is open. 156.16. I'm gonna go to the welcome. Let me open it, see if it was okay, so it wasn't open for you all. The welcome. See if you see it now.
Let me refresh. Yeah, it came up. It's on mine now, so I can see the welcome now. And I
Okay,
have
and
the
then at
book.
the
I just have to
bottom, you see
upload
it.
it.
You see it at the
Yeah, and I
bottom.
just have and the book is in my library, so I just have to download it. So I got the
Yes.
book too.
Okay. All right. So I'm glad we
Okay.
went through that so we can get some clarity. I'm glad you informed me of that. It was not open for you all to see. So we're in Introduction to Electronic Health Record, Module 156. We will be doing a lot of teamwork, getting partners together to work on assignments together. You will be in the front office. You will be in a clinic. So this is important for you to make sure that you're reading your PowerPoint slides as well as the chapter. So today we're going to cover, it says, what is a health record? History of health records, content of the electronic health record, who documents in the health record, who owns the health record, the electronic health record, transitioning from paper to electronic records. Now basically everything is electronic. You can't even fill out a regular application anymore. Everything is electronic. Electronic health record software, practice management software. Then in that next module, not the next module, but the next chapter, we will be covering advantages of the electronic health record. So we're going to go ahead and read through this first part. These are the objectives that you will be covering in this chapter. Explore the history and current use of patient health records, their importance to individuals' health and their contribution to the healthcare system. Become familiar with the content of a typical electronic health record, which is EHR. That's what the acronyms you will be seeing. EHR stands for Electronic Health Record. Explain who documents in the health record, discuss ownership of the health record, describe the basic functions and advanced clinical decision support, which is CDS, clinical decision support, features of EHR software. That's the 5 objectives that we'll be covering for this week. These are the key terms. So these are the key terms that you must know. This information here is definitely on your certification exam. The key terms, especially with the front office, when you take that medical office certification, these terms will be on there. Key terms, account ledger. What is an account ledger? It's a list of services provided, payments made by the patient, reimbursement received from the patient's insurance company, adjustments and outstanding amount owed. That's an account ledger. What is an audit? A review of employee activity within the EHR system, including an examination of which files were assessed or modified, when and why. So that's when they come in, like if they feel you're doing some up billing, or you done put stuff in the system for billing that's not accurate or fraudulent, that's when they come in and perform an audit. Chief complaint, the patient's stated primary reason for seeking treatment. So in billing and coding, you know how they went through that, the chief complaint, they always look for that in that medical record. What was the chief complaint? What was the reason that that patient was seeking treatment? Clinical decision support, CDS, a set of patient-centered tools embedded within EHR software that can be used to improve patient safety, ensure the core conforms to published protocol for specific conditions, and reduce duplicate or unnecessary care and its associated costs. That's clinical decision support. Computerized provider order entry, CPOE. This is a lot of times in the document. They're never going to put out computerized provider order entry. That is CPOE, an EHR function that allows a provider or providers appointed licensed healthcare professional or credentialed medical assistants to enter the ordered medications and tests using an automated format. This is CPOE. Continuity of care, a key aspect of quality that encompasses planning and coordination of care, communication among members of the healthcare team, and accessibility and transferability of information. This is in that MOA certification. When you take that MOA certification, these key terms will be there, especially when it comes to what you will be doing, medical billing and coding. When it's time to make sure that you're submitting that bill, all of these questions are going to be asked, and you have to know what it means. And this is how you submit that claim. The co-payment, a fixed sum of money dictated by the insurance company that is paid by the patient, usually at the time medical services are rendered. So when you start going into the clinic, when we start going into the EHR, you have to know what process that you're going to be using, what the co-payment is, everything that you would need to be doing when you're in that front office. Day sheet, a register for all daily business transactions, such as patient services, payments, and adjustments, also called a day journal. Documentation, the process of recording data about a patient's health history and status, including clinical observation and progress notes, diagnosis of illnesses and injuries, plans of care, patient education. All of this information is in the documentation in that medical record. And you're going to pull everything from this documentation in order for you to bill and get the most out of that documentation. Electronic health record. So a lot of people get confused with these two. Electronic health record is EHR, an electronic health record that allows for the management of a patient's health information by multiple healthcare providers and stores the patient contact information, legal documents, demographic data, and administrative information. The term can also refer more broadly to a system that manages such records. EMR. So many people get this confused. EMR, electronic medical record. Look at this, how they get it confused. It's an electronic health. So when you're taking that exam, make sure you're paying attention, even when we take this first chapter exam, because what happens is a lot of times you rush, you see an electronic health record that allows for the management, electronic medical record, an electronic health record that allows the management of a patient's health information by authorized clinicians and staff members with a single healthcare organization. An EMR is an electronic version of a paper record. Electronic health record, an electronic health record that allows for the management of a patient's health information by multiple healthcare providers and stores the patient's contact information. So see, this is multiple, this is single. So make sure you read it in its entirety, because a lot of people always get these two confused. Electronic health record, EHR, electronic medical record is EMR. Electronic transcription, data entry into the EHR using handwriting recognition, voice recognition, electronic system building, sentence building, scanning, and other means. You're going to be using all of these terms once you get with your partner and you're going in the clinic in the electronic health record, because it's a whole nother system. When you look at, we're going to go and I'm going to show you what you're going to be going into in this actual an office where you're going to be doing everything that you would be doing in the office setting. Encounter, interoperability, meaningful use, MU, part of the federal EHR incentive program. Office of the National Coordinator for Health Information Technology. Look at this acronym, ONCHIT. That's all you're going to see. And you know, they'll have a word that's missing, or they might have hospital information technology. That's wrong. It's health information technology. So always pay attention, never rush through it. Make sure you have the right information. Patient information form. Practice management software, PMS. Structured data entry. Super bill and counter form. You're going to be using this a lot once you all get in the clinic. An itemized form used to document services provided to the patient and the diagnosis for the services. Also, the main source of information used to create the insurance claim. This is what you all will be doing, these super bills and encounter forms. Third-party payer, a party other than the patient, spouse, parent, or guardian who is responsible for paying all or part of the patient's medical costs, typically the insurance company. And when you're doing your daily assignment, that's why I say it's so important to make sure you're reading those PowerPoint slides and you're reading through the chapter. It actually says, what is a health record? History of health records. And it has nearly, as long as there have been physicians, there have been health records. A patient health record is a complete collection of an individual's healthcare information. Chong Yi, who was born in China in approximately 200 BCE, is one of the first physicians known to have kept records on the patients he treated. I have this highlighted because this is always on there. This is very important. His written observation of patient signs and symptoms are one of the first known forms of patient documentation. A hospital in Damascus, Syria, built in 706 CE, was perhaps among the first in history to adopt the widespread use of health records. Health records or death ledgers were kept during the plague that swept through Europe during the 14th and 17th centuries. This is the most important information here. I got it mostly highlighted. Of course, health records haven't always been used in positive ways. Nazi physicians often kept meticulous records on each patient forced to participate in their gruesome, cruel experiments in the United States. Between 1932 and 1972, researchers documented the signs, symptoms, and complications of syphilis in the records of hundreds of African American men during the infamous Tuskegee syphilis experiment. The men were denied proper care and allowed to suffer long after penicillin was found to be a highly effective treatment for syphilis. Of course, in the United States and other developed countries, healthcare providers are required by law to report new cases of HIV/AIDS and other communicable diseases to the Centers for Disease Control and Prevention. That's on every test you encounter. They always ask that, which is the CDC. The person's identity is held in strict confidence. As you can see, the health record has been used throughout history to benefit individual patients and to advance medical knowledge through research. Of course, there was the occasional country physician who never saw a need to keep records beyond those to his own need, because he treated the same families in the same small communities generation after generation. The electronic health record versus the electronic medical record. Here are the differences. The electronic health record of health-related information about a patient, the electronic medical record, an electronic record of health-related information about an individual, conforms to nationally recognized interoperability standards. An electronic version of a paper record can be created, managed, and consulted by authorized clinicians and staff from more than one healthcare organization, can be created, gathered, managed, and consulted by authorized clinician and staff within a single healthcare organization. So remember the difference. Medical record, single. Electronic health record, multiple. Content of the electronic health record. The primary use of the data in health records is for patient care. That's the primary use, is for patient care. Each patient has his or her own health record in the provider's office. This record tells the patient's health story. It is the source document for providers and the documentation that provides evidence of care. Complete documentation in these records is vital to ensuring the highest level of care. The complexity of one's own health history is too overwhelming to memorize. Can you imagine trying to care for thousands of patients by memory? Impossible, and not an effective way to manage healthcare. It has been said, if it isn't documented, it never happened. You're going to hear that throughout you're working in the clinics. You can say, well, I just saw this and I witnessed it. If you didn't document it, it never happened. Every patient encounter with the medical office must be tracked. Every encounter must be tracked. Medical documentation of the events is the easiest and most effective way and is required by law. Therefore, maintaining the accuracy of the health record is one of the most important duties of the healthcare staff. The contents of the health record may vary slightly from office to office, but most records contain the types of documents in the following sections. Note, however, that there is some overlap among the categories. An insurance form, for example, is both an administrative and a legal document, and it may contain health information as well. Clinical information. The health record is the primary source of information about the patient's medical history, such as immunization records, operative reports, and progress notes. When you all get into your groups in the clinic, you're going to be putting in immunization records, operative reports, progress notes. You're going to have to document all of this in that record. This information is gathered mostly during patient encounters with the provider. Over time, the stored clinical data are used to predict risk for disease, compare measurements and values against one another, and determine what is or is not effective for treatment of illness or other health problems. The more complete the record is, the better the care the provider can offer. Clinical information includes the following. So when you get into that health record, this is the SIM chart. So I'm going to share my screen again. We always share, and I'm going to show you what you're going to be logging into. So in your e-learning, the gray section of e-learning, right above instructor resource, you're going to see SIM chart launch. SIM chart launch. This is where you're going to click. And you're going to see SIM chart launch again. And it's going to say launch the SIM chart. So then I'm going to give you also, it says SIM chart for the medical office. Then I'm going to assign you all of your activities that you're going to have to complete in the medical office, in the clinic. So when I launch it, it says SIM chart for the medical office. This is where all of your assignments will be. And I'm going to check them off like they have on here. Identify different types of appointment scheduling methods. Manage the appointment schedule using established priorities. When you look in your book, when you get to that part in the book, and they're going to have each patient, and they're going to have all of the information that's going through what you're going to be doing. So you're not to that part yet because you got to learn the basic information. And it's going to tell you in your book when you're going to start with that first patient.
Miss Berry,
Yes.
do you say that's that part where that SIM chart launch is already open in the gray section of the e-learning thing?
You're
you
going to
haven't
have to
opened it
open
yet?
it. Oh, you're saying with
And
that?
you,
Well, right now you
yeah.
don't have anything to do in that part yet, so it's not open yet.
Okay, all right. I just wanted, because I still had the e-learning thing pulled up, but I didn't see it. Okay.
Yes, because when you get to that part, then I have to open it.
Okay, all
Because
right.
right now it's the basics that you're going to be covering. And I assign you all, once I assign you all partners that you need to work on in the clinic.
Okay, I just wanted to make sure that it wasn't something that,
Yes.
that wasn't open for us or whatever, or not. Okay.
Yes. Okay. And then also on here, let's go to the PowerPoint slides. It's going to give you that information as well. So we already went through these 5 objectives. Then the next one would be here, but then it's going to start telling you when, it's going to let you know in your daily assignment when you need to start launching the SIM chart. And then I'll be sending you that in the email as well. So let's go right here. Like we're doing this now. What is a health record? So nobody should ever be getting your daily assignments or your labs confused or getting the wrong answers, because when you're getting the wrong answers, that's letting me know that you're not reading the information. Because in your PowerPoint slides and in your chapter, it gives you the answer to all of the daily assignments and your labs. But you have to read. I told you in medical billing and coding, it is reading, reading, and more reading. You have to read everything that's going on. And you're going to see how important it is once you get into this clinic and you're seeing all of the information that's required, how you have to go back on one page, look at another page to be able to verify and input that information. So on here, the first, like your daily assignment, it has on here, what is a health record? Let me go back right here. Yeah. What is a health record? It gives it to you right here. A physical collection of an individual's healthcare information used throughout history to document patient healthcare, signs and symptoms, diseases, trends of disease. Again, I explained to you, make sure that you're looking at the bottom slides underneath your PowerPoint slide. It has, how has medical documentation been used throughout the years? And it, you know, your answers will vary. Why is documentation of all of patient care so important? That'll be in your own words. Then it says health record EHR. Trying to go back and keep skipping on here. Content of the electronic health record EHR. Each patient has his or her own record. Documentation is a vital component of the EHR. It contains health information, administrative information, and legal documents. This information is contained in an electronic health record. It tells you right here at the bottom the questions, and it says your answers may vary. Clinical information. So in there, when you start doing and working in the clinic, the clinical information, this is what consists of clinical information: medication list, allergy list, immunization records. And I'm gonna let you know now, this is on your first exam. Clinical information that's included, and you're gonna have to put it. You don't have to put all of them, but at least I was like 4 or 5. You're gonna have to submit it. Medication list, allergy list, immunization records, laboratory reports, pathology reports, vital signs, growth charts, surgical reports, hospital records, history and physical assessment findings, progress notes, radiology reports, imaging test results. All of this information is clinical information that's documented in the medical record. Administrative information, patient's demographics, name of emergency contact person, patient correspondence, referral and consultation letters, insurance information, HIPAA claim status, billing account ledgers, super bills and counter forms, day sheets, appointment history, diagnostic and procedure codes. All of that information is included in your medical record. So again, once we get ready to launch the SIM chart, it will be open for you. Once you get to that part in your book, it will let you know step by step on what you will need to do. So next, this is just an overview, just an introduction, because we have class on Thursday, and then we will be launching the SIM chart. And so if you look at this page here, this is what it will look like. Your encounter form, they're going to have the encounter type. And it says follow up, establish visit. Medication. So you're going to have to go in on the side, like you say, patient charting. And they have the info panel, patient dashboard, office visit, phone encounter, diagnostic lab results. This is an office visit. So you're going to go in and you're going to put in the information that they're requesting. And you're going to have to know if it's an office visit, a phone encounter, whichever one it is, you're going to have to be able to put in this information. It has encounter type. So it says office visit, follow up, establish visit. You're going to make sure you have to put that date in. Medication dose. You have to put what that is. Strength form. Put that information. Route frequency, oral daily. Status, active, entry by. Who put that entry in? The date. Action. So this is the information when you're working together on the information you're going to be inputting, but you're going to have that patient information in your book. But you're going to have to know when you're reading it on where does it go? Where do you need to put it? So that's how your encounter forms are going to look. And they have on here, front office, clinical care, coding and billing. So each section you're going to be going through, you're going to start out in the front office, then you're going to move to that next section, then you're going to move to the coding and billing. Well, you're going to use your coding book. That's at the end where you actually have to put in a code for whatever the documentation stated in that chart. So this module is a lot of fun. It's going to be work. It's going to be what you're actually going to be doing. So it's going to be interesting. And we went through this, the SIM chart for the medical office medication list. That's in your PowerPoint slides as well. Like I said, some people prefer looking at the PowerPoint slides for more clarity. Administrative information, we covered that. What's included in administrative documentation. Legal documents. The complete health record is considered a legal document. The complete medical record, that health record is considered a legal document, as federal law requires that providers document patient care. In addition, a patient health record may be used during court proceedings for malpractice suits. Thorough, accurate documentation helps prove what, when, and why care was provided. For example, a complete record will show what information was provided to the patient and what decisions the patient or the patient's family made concerning care options based on that information. Thus, proper documentation is important to protect the practice as well as to ensure that the patient receives high-quality care. Within a health record, there are legal forms, some such as do not resuscitate, that's DNR, do not resuscitate, DNR orders, may need to be assessed quickly so that the medical team knows how to proceed in an emergency. Others are used to document consent and treatment options. Legal forms include the following: health record release forms, consent forms. Here is what you'll be looking for as well when you're going through your SIM chart. They're going to have general procedure consent. So you're going to have to read through all of that and make sure you have to fill out and complete that information. So make sure that you review these forms. It's in your electronic health record physician's office book. Each form is going to tell you what you need to do, and you have to follow each step by step, or it will let you know that it's wrong. After each section that you complete in that health record, it's going to be a short quiz after each little example, and it'll let you know, it's going to be scoring and letting you know what your actual score is. SIM chart for the medical office general procedure form. Health Insurance Portability and Accountability Act, HIPAA forms, Notice of Privacy Practice Acknowledgement, Advanced Directives, Living Will, DNR, Healthcare Power of Attorney, Disclosure Laws. The data found in health records has a secondary use. It can also be used to education research, public health, and improve healthcare delivery. Who documents in the health record? Physicians, nurse practitioners, physician assistants, nurses, and clinical and administrative medical assistants all document information in the patient's health record. All aspects of the patient encounter must be recorded in the health record, including the following patient health history: the chief complaint, clinical observation, diagnosis, tests that are ordered, and treatment plans. The patient's information is documented in chronological order, including all new information or charges to the patient's health. Structured data entry, so everything has to be documented. So make sure you read through who documents in the health record. This information is gathered using a patient information form. The receptionist may be responsible for documenting Notice of Privacy Practices, NPP. notice of privacy practices, acknowledgements, chief complaints, co-payments, requests for prescription refills, and authorizations to release health records or obtain records from other providers, as well as for recording no-shows or cancellations of patient appointments. This is what this form will look like that you will be documenting in your electronic health record. Form repository. So you're going to be inputting all of this information from the information that's provided to you on that patient. The next documenter will generally be the clinical medical assistant who accompanies the patient to the examination room, records weight and vital signs, and notes preliminary clinical information, such as an expanded chief complaint, including a history of the present illness, the duration and context of the chief complaint, medications, including over-the-counter and herbal supplements, and any known allergies. And so when you go into that medical chart and you're getting ready to code and bill, you have to pull all of that information out of that medical chart to be able to bill. Everything, like they said, medications, including over-the-counter, all of this stuff is documentation that you have to read through to get an accurate bill that you need to submit. Many different healthcare providers may have documentation responsibilities, including the following: primary care physician, physician's assistant, nurse practitioner, physical or occupational therapist, social worker, specialist, surgeon, medical biller. Each of these providers may contribute to the patient health record in different ways. For example, the physical therapist correspondence will document the treatment plan and progress. Whereas the primary care physician is responsible for coordinating all aspects of the patient's care. The medical biller may need to document the patient's insurance information and authorization numbers, as well as file appeal letters and abstract data for claim submission. So a lot of people don't understand on this part when it comes to who owns the health record. Patient health records are considered the property of the individuals who created them. The property of the individuals who created them. For example, a provider in a private practice owns the records created in his or her own practice. Records created at a hospital or a long-term care facility are the property of the institution. However, the patient controls the information within the health record. That's the difference. The patient controls the information within the health record. In other words, the patient has a legal right to access or view a copy of his or her own medical information at any time by signing a medical release form. However, the original copy of the record never leaves the facility that owns it. The patient also has the right to request restricted access, request amendments to errors, and obtain a list of disclosures who has viewed or received the information. That's why when you go in a clinic, a lot of times people just sign. Make sure that you're reading the information that you're signing. When they're giving you a sheet of paper, don't just, they say sign here and you sign it, because you don't know what you could be signing. So always read that information. And when you're in that clinic and when you're going to have to read everything that's in that medical record. A medical practice may legally charge a fee for copying a health record. This charge is based on the cost of preparation and production of the health record. A provider cannot withhold copies of the health record if a patient has an unpaid balance on his or her account. They will try. But see, if you don't know the rules and regulations, they will definitely try and say, well, you owe this. They cannot say that they can't give you the record because of an outstanding bill. And then when you get to your critical thinking, like it's going to be, this is how it looks in your SIM chart. Exercise 1.1, it states, Sherry Mackin is a patient at the office where you work. She plans to move out of state and insists on taking her original paper patient medical chart with her. The office manager refuses to release the record to her. Miss Mackin has just faxed a letter threatening to involve her brother-in-law, a personal injury lawyer, whose ad appears on the back cover of the local phone book. If she does not receive her records within 1 week, who legally owns the health record, and how can the patient's situation be resolved amicably? Answer, somebody answer. Who legally owns the health record?
The office.
The clinic, the clinic, the office.
Right. But does she have a right?
To have to know, she can't get the
Yes.
original, she can get a copy.
Right. She can get a copy. So you're going to come in contact with so many patients that's going to want their record. But that facility owns the record. She can get a copy, but like they say, some places do charge a fee for them to copy your records. It says one exception to the patient's right to view his or her health record is called the doctrine of professional discretion. This principle states that a provider can exercise his or her best judgment when deciding whether to share progress notes and clinical observations with a patient who is being treated for mental or emotional disturbances. The doctrine of professional discretion is intended to protect mentally or emotionally ill patients from any additional harm that viewing their health records could cause. For example, fragile patients who are depressed or suicidal may be upset to read the practitioner's assessment of their unstable condition. So we're going to stop right here. So just think about, like I said, I'm going to put you all in groups. Usually it's 2 or 3 that you will be assigned to. Remember, like I said, we have different classes. So you will be in a group with your class, so it won't be so complicated, and the other groups will be in their classes. But make sure that you're reviewing these, your PowerPoint slides. Make sure that you're reviewing the documentation, because this is going to be fun, but it's a lot of work. But this is what you will be doing. This is what you're in school for. So you're going to get hands-on experience on if this is something you actually want to do. Because it's very tedious, but you have to be willing to read. You will not get through medical billing and coding without reading. It's reading, reading, reading. You will be using, reading documentation all day, submitting claims, documenting insurance information, verifying information. This module here and the next module, 156 and 157, this is what you will be doing. Documentation, you will be in an actual, everything you're seeing when you're reading, you're going to be in an actual clinic working with one of your classmates on providing and submitting this information. So like I said, as you go through your daily assignments, then you will see where is then when you're going to start to activate and launch your SIM chart. So I'm going to go back through the SIM chart again. Let me just go back to the first part of it. You're going to go to your SIM chart launch. Let me go back. Let me get out of it. When you launch the SIM chart right here, SIM chart launch, it's going to come up like this, SIM chart launch. Then right here is going to say launch the SIM chart. You're going to click here. And it's loading. And then when you see, when it says SIM chart for the medical office, but I'll have all of the assignments checked that you would need to complete. And then you're going to look in your e-learning, not your e-learning, your vital source in the book, and it's going to give you the patient's information. And then you're going to read that patient's information, and then you're going to document it in your SIM chart, in the actual clinic, in that record. So on Thursday, we're going to go through it again. By that time, depending on what assignment it is, I will have provided you with some courses for you all to complete, but I'm going to assign groups. So make sure that you're reading your emails. I will be sending it to you in emails, and I also will be giving you groups on the Zoom call Thursday for 4 p.m. So I'm going to stop sharing right now. Any questions? Any questions or concerns? We're in module 156, day 1, and 156, day 1 lab. Any questions on anybody needing this week's assignments open from last week? I sent an email and I put in assignments. Please email me your assignments. I have to have all grades submitted by tomorrow, 5 p.m. So anything that you are missing from module 155, you need to email it to me and send me an email stating that you have sent that information, because I'm going to be grading. Like, you know, I said, I dropped your lowest grade from whichever course it might have been. Like for 155, it was a daily. If it was a lab, if it was exams, I'll drop that lowest grade. But I need you all to submit, email me assignments if you have missed assignments, and then email me letting me know that you submitted an assignment so I can go and update your grade. All grades for this module have to be submitted by tomorrow, 5 p.m. No later than 5 p.m. I have to submit all grades. So please make sure that if you have something that you need to complete to boost your grade, please submit it via email and let me know so I can go back in before 5 tomorrow and submit your grade. Any questions or concerns about this module 156, or any questions or concerns you might have? Ebony, make sure you go and check and make sure you're getting your emails.
I logged into it. I'm getting them.
So
I was logged out. I didn't know I was supposed to check emails through Microsoft.
Yes, ma'am. All of your emails, like I said, so you saw the tons of emails you had?
Uh-huh.
Yes, yes. Tyra, you're being mighty quiet. You're not fussing with Jared today.
Oh, Lord, I don't even have the energy. I was just about to comment on Ebony and say, Ebony, don't feel bad, baby. I felt the same way. I don't read no emails, baby. So don't feel bad.
So wait,
I'm
so
new
what you
to
saying,
this.
Tyra? You still not reading emails, Tyra?
Oh, yeah, I'm reading them now, but you look how far in that I had to get it together. It took me a long time.
Yes.
But I got it, though. I got it now. I got it.
So, Ebony, you thought I was just not communicating?
Oh, maybe she communicate.
I comment on one of the things and you told me you was gonna do it through email. I was looking through my regular email.
Oh.
I was looking through my regular. I said, she commented back, so don't worry about it.
Yes, when you submit it through email, I will comment, but I'm thinking you're getting it through the, you know, the e-learning. Okay, well, everyone have a great evening. Remember, on Thursday, please try to join on Thursday, because we will be launching the SIM chart. We will be doing it step by step so that you all understand how to launch it and how to access the exercises that you would need to submit. Think about if you all know anybody you want to buddy up with to do your clinic, to be in a clinic, submitting information. You know, you can go in your emails and contact your classmates via the roster in your e-learning emails. So work on that. I know I have quite a few newer students, you know, so my newer students, I would like, I mean, since this is new to everybody, So everybody that's in 156 now have not been in 156. So this is new to all new and the students who are in here now. Remember, we have graduates tomorrow. We have 3 students who will be graduating tomorrow. Misty Thornton, Ashley Manuel, and Misty Duet. They are graduating. Tomorrow is their last day. So they done completed, they are gone. I cannot believe Misty not on here with us today. Look, to say her farewells.
I know.
Yes.
And
So
she
we
always
have,
has something to
I
say.
know we have 3 graduates. So they're moving on. They're getting prepared to take their certification exams, the medical office assistant exam, and the billing and coding exam. So, we want to wish them the best, in whatever they accomplish, and hopefully they pass those certification exams. So,
Oh, yes.
yes. So if y'all have any other questions, remember, I need that day 1. I was looking, I said, nobody submitted a day 1 assignment yet for 156. Jared, don't forget to do that day 1 like you did last module.
Right, Jared. We got to be on it, Jared. Jared, you're going to get us in trouble.
No, I'm on it. I'm on it.
You can't say you was sick this time because ain't nobody want to hear that this time.
I'm pressing count for the day.
Jared, do you see how Tyra is calling you out?
I'm just saying. That's okay, Jared. We both had missed it, so we're going to do better this time.
So,
that's right.
Remember, everybody, like all of you who are on right now, you will get credit for attendance regardless, but make sure you complete that day 1 assignment. Also, again, I just want to go through right quick. Make sure if you have any assignments that you need graded to boost up your grade for module 155, please email it to me. Do not put it in a comment section. I've logged out of that already. Please email it to me, and then I'll go into the grade book to update your grade. So review, go back in 155, look to see if you have any missed assignments, and try to submit them as soon as possible. Everything has to be turned in tomorrow by 5 p.m. So you all enjoy your evening. I will see you all Thursday for 4 p.m. to launch the SIM chart. You all have a safe and great evening, and I'll see you Thursday. Bye-bye.
Good night.
Night.